Welcome to CareQuest Solutions with Mark and Ann. We have episode 2 on our four-part series. How you doing today, Ann?
I'm doing great. How are you?
I'm doing good. So what are we talking about today?
Well, today we're going to go over skilled nursing, which is nursing homes. So it's kind of both. And we're going to talk about that. And we're going to talk about rehab hospitals, personal care homes, and kind of the difference in all of those and what
Very
happens.
good. So a
Okay.
lot to talk about, right?
It is. It is. A lot of differences.
Yep. All right. Well, let's count this down and we'll be right back.
All right.
All right. We're off and going. I want to say once again how proud I am to have Ann being a co-host on this show. We have got so many things to look forward to. And Ann, we've got a really super duper guest coming on in August, don't we?
Ooh, we've got a couple of super duper guests
We do.
coming on in
We
August. We
do.
do.
Why
I'm
don't you
super
share with
excited.
us those? Who are those couple of guests?
So we have Teepa Snow, who is just known for Miss Snow speaks all over the country.
Mm-hmm.
She is known for her dementia classes, and it's just anybody that's had an opportunity to hear her speak, you can't help but just be in awe of her and
Yeah.
what she does. She's just wonderful. So I'm really excited about having her on. We also have the group with Second Wind Dreams coming
Mm-hmm.
on board. And so Anna and PK are going to join us, and we're going to talk about the virtual dementia tour. And I'm really excited to have them. I don't want people to miss either one of those episodes.
Yeah.
It's going to just be so full of information. Even when you and I spoke with Anna, we kind of laughed
Mm-hmm.
and said we may have to do two parts.
Yeah. Absolutely.
Because
Yeah.
there's so much information and they are bringing so much to the table for people to hear. So I really want them to hear that.
Yeah.
Um, Even our next guest, I'm really excited to have not next week, but the week after.
Yeah.
We've got Scott Watkins coming on board from Family Hospice.
Yeah.
And we're going to talk really in depth then about hospice and some of the myths about hospice. And it shouldn't
Mm-hmm.
scare you to hear that word. So
Yeah.
Scott's gonna help us out with that. So we have really got an exciting lineup coming.
I am just stoked about it, and hats off to you because if it wasn't for you, those would not be getting lined up. So high five
Well,
for doing that.
you're a virtual high five, but, it's just, and people listening to this that know me would tell you, I laughed when people started telling me to do a podcast because I've said,
Mhm.
well, I probably could because the one thing I can do is talk.
Right.
So I don't mind reaching out to people, and I'm just so passionate about what we're doing.
Yeah.
I think it's
Well,
so important.
we do, as has mentioned, encouraging to share the information, spread the word, help us really build this channel because Ann and I are doing this to really put our best foot forward to make a difference
Yeah,
because this is a very
absolutely.
difficult journey in people's lives, and you cannot have enough resources. So hit that thumbs up, like, share, comment on the episodes. But Ann, let's kick this off and turn it over to you, and let's talk about our part 2 of our 4-part series, which is skilled nursing versus rehab versus personal care home. So take it
Okay.
away.
All right. Well, let's get this started. I'm really excited to talk about this today because I feel like we're really in my wheelhouse
Mm,
when we start talking about nursing home and skilled care and those kind of things, because those are things that I feel like are just in my heart.
mm-hmm,
Um, I can tell you that nursing home just runs in my blood. I love it, loved what I've done all these years. So when you talk about skilled, you can be talking about going to skilled care at a nursing home or a rehab
mm,
hospital, but there's a very different criteria for both. So, for rehab hospitals, let's talk about that for a minute. And there's a few around. There's some really big name ones up in Atlanta area. And even in our area, we have some really good ones around. But the criteria to go there, and people get a little confused because we've had residents at the nursing home come for skilled care, which is just short-term rehab at a nursing home. And that's what I'm going to talk about too.
Okay.
But they get there and they say, well, I want to go to a rehab hospital. Well, at a rehab hospital, there's a couple of things. First of all, you have to be medically stable, which
Okay.
means you're not having any issues with your blood pressure spiking and those kind of things going on. You can have had a stroke. You can have had a spinal cord injury. They work with those kind of things, but you still have to be medically stable. So if someone has a feeding tube, for instance, let's just say they have a nasal tube and they're going to go to a rehab hospital, they can take you. And that's going to be a case-to-case basis for them based off of you've got to be able to come off of that tube prior to leaving there, because that's going to be
Who makes that decision? And does the family have anything to do with that decision?
Well, that decision is going to pretty much be at the hospital. They're going to know whether, feeding tubes and that's into skilled care and those kind of things, but feeding tubes are not necessarily permanent. And people, again, I think misunderstand that sometimes. And they think that, oh my gosh, they're getting a feeding tube. But feeding tubes can be removed and people can begin to eat again. And speech therapy is who is going to work with that. People get confused with speech therapy about things, and speech therapy does so much more than talking. It's not about talking in your speech. It's really about your swallowing. It's about cognition.
Okay.
They deal with a lot. So at a rehab hospital, if they know going in, and they're going to know from the hospital, if this is somebody that's pretty much going to have a permanent feeding tube, those kind of things, surgically inserted, that kind of thing, you're probably not going to go. One of the biggest things for a rehab hospital is it is very intense therapy. And people always think, well, I can go there and get out quicker or whatever. Well, you might can, but you have to be able to do like 3 hours of therapy a day. And that's a lot.
Oh, wow. That's a lot.
It's a lot.
Well,
it's pretty intense, but that's what you're there for. They're there to get you better and get you home.
Yeah. Well, let's distinguish, just to throw it out there. It came to my mind that when we're talking about rehab hospitals, this is not rehab for addictions. This is not the type of rehab we're talking about.
No.
Right. So some people, when you hear rehab, you think, okay, rehab, I don't have a drinking or a drug problem. That's not, of course, what those are two totally
and you're
separate
right.
things.
It is therapy being speech therapy, occupational therapy, and physical therapy. So those are the therapies we're looking at. You're correct. And I'm so used to it. When you work in healthcare, we love acronyms and all that stuff, and we throw them out and don't realize people don't know. So thank you for clarifying. But yeah, we're not talking about any kind of addiction. We're talking about physical, speech, and occupational therapies that you're going there to get. And when we're talking about skilled care, that's typically what you're talking about. Because if you're talking about the other, it's a whole different conversation.
Right.
So you're doing 3 hours of that. And I'm not sure if people always realize how intense that is.
Yeah.
We have on the nursing home side, when they come in for skilled therapy. So here's a good comparison for you. Therapy is going to go work with them. You might get 30 minutes. Dependent on the patient. If they can do 30 minutes, they're going to do 30 minutes. If they can do 45, they're going to try to get 45 with them. If they come back in and they can't do another therapy that day, they're worn out, that kind of thing. But you think about doing 3 hours, you're walking, your body hadn't been used to that, depending on the reason you're there.
You're there, right?
Yes. Somebody like a fractured hip, those for a rehab hospital, you can go there and do that. But getting up and walking, and it depends on all of the other medical conditions going on with that person, on whether they really can do 3 hours of therapy. And so that's why there's just the criteria there. You just have to know going from the hospital, and rehab hospitals will assess and see if they meet the criteria to come there.
And you just made a good point. you made a good point. Let's say someone is in the hospital, and I'm
Mhm.
asking this as an example because we faced this with mom, to where
Okay.
mom was in the hospital. She had, developed pneumonia and was literally told she was not going to survive the hospital.
Oh,
Well,
yeah.
then it got to the point of, okay, she's surviving, but now we kind of almost have to save her from the hospital because they only go so far,
Yeah.
right? So
Yeah.
it was the decision of, do we send her to rehab to rebuild her strength, or does she come home with hospice? So with that example,
Yeah.
kind of explain, when a family is facing these steps and decisions, and the importance of making the decision to let the hospital be involved to discharge to rehab versus home. Because if you do the wrong thing at the wrong time and the hospital discharges you home, you've almost messed up the chain of events to be able to go into rehab. Is that correct?
Well, yes and no. But
Okay.
I'm glad you brought that up because here's the thing. On the on the okay, on the nursing home side of this, skilled care, which is what everybody calls it now. They don't really use nursing home as much, but skilled care
O-
to go to a
Okay.
nursing home. If
Okay.
if they meet the criteria to go to a rehab hospital, they are not going to be in the situation that your mom was in.
Okay.
Typically, someone in the situation that your mom was in, she was so weak.
Hmm.
Um, I believe you shared she's 92.
Hmm.
At that age, with what was going on with her, then probably they already knew she would go to skilled care at a nursing home. So
Okay.
this happens. So let's say you've got a family and the hospital is saying
Mm.
she really could benefit from some therapy, and we think you should go for some therapy before she goes home. Well, it scares everybody that it is a skilled care nursing home, and
Okay.
they're like, "Well, I don't want to go to the nursing home. We want to take her home. We want to take her home." You can take her home. She could get home health at home, because home health comes out and home health provides therapy. It's not as intense as what she would even get at a nursing home, and certainly doesn't match what they would get at a rehab center. But going into a nursing home for skilled care for someone like your mom would provide her, um, probably a more, um, geared
There.
toward her therapy that would be better for her and what she needed, and meet her needs much better than a rehab hospital. Now, if you said, "Well, I don't think we want to do that, and we're just going to go home," we're going to go home with hospice. And you
Hmm.
get home, and mom starts to kind of rally a little bit, and
That's
you're
what. That's
thinking,
what's
"Heck,
happened. Yeah.
we should have done, we should have done therapy. We
Yeah.
should have done therapy." There's a couple of things that can happen. First of all, and my hospice friends, don't shoot me for this, but you can rescind hospice. So you can say,
Okay.
"Okay, you know what? We want to give her a chance." Most hospice companies, and we'll talk a little bit more about that next weekend with Scott when he comes
Hmm.
on. Most of them aren't going to pay for therapy.
Okay.
Um, there's some that might if something comes up and they need it a little bit, but typically they don't cover therapy. So if you've gotten her home, now here's the thing to look at. It just depends on how long you've been home with them.
Okay.
But for a nursing home skilled therapy, if you discharge from the hospital, you get home 2 weeks later, you think we should have done skilled, and we should have just let mom go for short-term rehab at a nursing home skilled facility and do it that way. You still can,
Okay.
because Medicare will cover, as long as it's within 30 days, that skilled facility can still bill the Medicare Part
That's
A.
within 30 days.
Yes,
Right.
of
And,
discharge from the
and
hospice.
this is such powerful information. I'm telling you, because obviously you're coming from a full place of knowledge. So the things you're sharing helps me to help sort of bring up things that I think is easy to overlook and misunderstand coming from the layman side.
Yeah.
Because there's, like you're saying, there's a difference between skilled nursing rehab hospital versus skilled nursing in a nursing home. They're
Yes.
both called still skilled nursing, but there's different levels of that rehab depending on the age, the circumstance, the situation. That's There's so many people that are going through this that this is like,
Yeah.
wow, I had no clue.
Yeah. Yeah. And you look, even if you're working in a nursing home, heck, CMS changes it every day. So, the
Okay.
stuff changes all the time. But this does not as much. But, if they go home, they do still have the option. If they discharge from the hospital within 30 days, a nursing home can go back and bill their Part A. So they could still become, even coming back from home, um, even giving up hospice to go back and do that. That doesn't mean that you just walk away from hospice forever. That
Right,
group is
right.
still going to stay in touch and they could still help you when you get back home.
Right.
Um,
That's same thing with hospice, like, mom being at home with 24-hour care. If mom moved into a memory care,
uh-huh.
hospice moves with them. It's not like you've got to
Yes.
go,
Yes.
that has to stop. No, she's already under hospice care. You're
Right.
just reducing costs to go into, a memory care or assisted living versus it being done at home. So, but
Yeah,
anyway, go
they
go.
now you do have to what we call rescind hospice. So you do have to stop hospice. If you go from home and go to a skilled nursing, you have to stop the hospice. So the hospice care is going to stop. They're not going to go with you to the nursing home because they're not going to cover the
Right,
skilled.
that's to a nursing home, but they will into assisted living, community, or memory care.
Yes,
Yeah, okay.
absolutely they
Yeah,
will.
that's what I
Yes,
was mentioning.
absolutely they
Yeah,
will. They'll stay right there with them.
yeah.
And again, hospice we're going to talk a little bit more about next week with everything they
Mhm.
provide. And then Scott, certainly the week after, will go into a lot of detail on that for us. Um, but yes, so there is a possibility. So, that's why I think what you and I are doing is so important in getting this information out, is because there are things that people don't know.
Yeah.
So again, and I know we say this at the end of every episode, but I'm going to say it right now, reach out.
Mhm,
Send us an email.
mhm.
You can email Mark. You can email me. It doesn't matter which one. Just reach out. There's a number on the website. So for CareQuest, if you pull up CareQuest Solutions, there's a phone number out there. I'm sure, Mark, you can shoot out the emails and stuff, but email us, ask me a question, please. I have people that email me and ask me things all the time, and I'm glad to answer because it can get very, very confusing. So reach out, ask the questions, and let us help you with
Mhm.
what's next and what you can and can't do and those kind of things. Because we can help getting you to an assisted living if that's where you're going. We can help with that. And I'll be glad to answer any questions about nursing home and those kind of things.
Mm.
So let me back on track a little bit.
Right?
But when I know we chase rabbits. I can't help it.
It's hard not
Um,
to.
I know it is. So that's Rehab Hospital. There is criteria for that. 3 hours worth of therapy. Those are your big things to look at. Medically stable, and those are the things that they are going to tell you have to be considered to go to a rehab hospital. So skilled nursing home. Skilled nursing home can take somebody that's fully on a feeding tube. Some take vent. You're probably not going for skilled
Mm,
care. If you're going in for a vent, you're not going for therapies. Different wounds. Wounds are staged in our industry. So you're going to go from a stage 1, you're going to go to a stage 4, which is really bad, into unstageables. There's all kind of things with wounds that matter. But skilled nursing home can take all of those and
mm,
can do with those and still be able to do physical therapy, speech therapy, occupational therapy, whatever's needed. Everybody going in doesn't need all three. And they determine that on an evaluation when you go into skilled nursing. So I am going to say this. So whoever's listening to this, please get a pen and paper. And let me tell you how this works, because I know this is a huge question for
mm.
everybody that they don't get. Your Medicare. It is not Medicaid. It is
Okay,
Medicare
yeah.
Part A. When
Alright.
you go into a nursing home, Medicare Part A will pay for the first 20 days at 100%.
Okay.
You aren't going to be paying a dime. There's nothing the family has to do if you have traditional Medicare Part A. Okay. The nursing home is going to talk with you about it. The business office is going to explain it in detail. You're not going to have to do anything for that first 20 days. Now, there is a Medicare copay after 20 days, and you'll have to deal with the facility on how that works and what they do with that. That the
But it
family
will
does become
continue. There'll just be a
responsible. Yes,
copay,
there is a
right?
copay with it. There are insurance policies out there that, I'm in Warner Robins. I'm in a military town. A lot of people around here have TRICARE for Life and things like that. Some of those will kick in and pay that copay for them. It just depends on your policy. But again, that's a conversation that you have with the business office, and they will give you all those details. But I want people to understand it is Medicare Part A that pays for that. Medicaid in long-term care, and we'll go over this. That's a whole different
Oh, no,
podcast to
yeah.
talk about the cost.
Jeez.
And we can talk about that, but that gets into your long-term, but it's totally different from Medicaid in the community. And so there's a lot to talk about there. But you go in for skilled care, and typically, I would dare say that at least 99.9% of the nursing homes out there have a separate unit that you are going to be on. You wouldn't be in the long-term care unit. You would be on their short-term rehab wing. Typically, it is right there next to therapy, very close by. And I say it that way because even my own mama said, I don't need to be here with all these old people.
Mm.
My mother was in her 80s. So, that's what the way people think. But you're not in there with all these old people. You are on a short term unit. You typically don't have to go to the dining room if you don't want to. They do encourage it. Some have a separate dining room for rehab, and you can go into that dining room if you'd rather do that than staying in your room with an overbed table and those kind of things to eat. So you do have options to do that. But they have a rehab wing. You go into that, and then they do the evaluation. The being medically stable doesn't become as important when you're going into a skilled nursing home like that, because they're more equipped, because they are long-term care in the majority of it, then they're more equipped to deal with a lot of that.
Mhm.
You can still be somebody going into a nursing home that has a feeding tube, that may not have that feeding tube come out. Medicare will still cover that first 20 days at 100%.
Mm.
There's actually more to that, and I'm not going to say it because it's going to be confusing. So I'm going to leave that to another conversation. But
Well, yeah, that gets back to what you're saying, reaching out and being able to
yeah,
connect someone. Because
yeah,
when you get into Medicare, Medicaid, and somebody says, "Well, what if something happens and I haven't applied yet? How long does it take?" That just call, reach out, and
yeah,
it
yeah.
gets complex. So, in the sake of time for viewers, let's go ahead and add in the personal care homes and how that separates and what they can and can't do. That in itself is a can of worms, right? So,
It is. It is. And, personal care homes can be good, but you're not going to personal care home for any kind of therapy.
right,
People that, and I threw in the personal care homes this week because I was talking about nursing home as well.
yeah.
So let's say you're long-term care for a nursing home, that you're not even going for skilled care and that kind of thing. We have a lot of people that will say to us, well, they're very alert and oriented. They know it. They can have a conversation like you and I.
Mhm.
They may have some kind of physical, maybe they're in a wheelchair. They can still transfer themselves. They can still do the majority of their ADLs, their activity of daily living. They can do
Mhm.
all their ADLs on their own, most of them. They may need a little assistance, a little oversight with things, somebody to help them just kind of sort out, okay, yeah, these are my meds. This is what I'm doing. They may very well qualify for a personal care home. But we have people that say, I want to go to a personal care home, and it's not. We have families that, well, I'm just, we don't want to be in a nursing home, so we're going to have mom go to a personal care home. Well, if mom has dementia,
Mhm.
and the thing about a personal care home is that in a personal care home, you have to be in an emergency able to get yourself out. Let's say there's a fire. You have to be able to get to that exit door. That's not to say there's not going to be somebody there that can help push you out or those kind of things, but you have to be able to respond know that there's a fire, know that you have to get out in any kind of emergency. And you have to be able to do that. You do have to be able to provide for yourself a lot of care. They don't have nursing staff 24/7. They do have people that are there, and they will have nurses that come in. Some may have a nurse that's there on staff, and maybe she is there at night, those kind of things. But they're not dispensing medications and doing that all the time. So you
Well,
really have
yeah,
to be
and
careful.
sorry to interrupt. I think people need to
No,
understand as far as if they're thinking about regardless of going from to another personal care home. Same thing with someone wanting to get placed into assisted living community or a memory
yeah,
care community. Personal care home is just a private person or someone that has taken a home and converted it into a personal care
yeah,
home. And there's a lot out there, but you also have to make sure, let me use the word, legitimate and
yeah,
capable of
yeah,
taking care of someone depending on what their needs are. Because unfortunately, there are some people that will open up, call it a personal care home. If you're in a decent sized neighborhood, you probably have one in your neighborhood and don't even realize that you have
yeah,
one in there.
yeah,
So it's something that has to be uh, dived into a little bit deeper. Um, but I just wanted to make the distinction of that's what a personal care home is. It's literally
yeah,
a house in a neighborhood. Some, depending on the licensing of the county, that's allowed how many beds can be in that, or if
yes,
they have to apply for a business care home, which could
right.
still be a house, but they are allowed to have more beds available.
Mhm,
So I wanted to make
mhm.
that distinction.
Absolutely. Yeah. It's you just really have to look into it when you're talking about personal care homes, because you're
Mhm.
right. There unfortunately there have been some in the last several years that have really come under scrutiny for those
Mhm.
reasons. And you want to make sure that you're choosing one that is a legitimate a lot of them are in homes. There's some out there that are just personal care homes that are built for to be a
Mhm.
personal care home.
Right, 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 right.
Yeah, so you can run into that, but you're right. It's making sure that it's legitimate. And again, that's a reaching out. That's just doing the research on it. And
Mhm.
we can do that for you. We may be familiar with it if you tell us the name of it anyway.
Yeah.
If you reach out. So there may be some things we can help with to save you some time on that. But personal care homes can be great for some. There's a lot of nursing homes out there that don't take people that smoke. Some
Mm.
do, but they're few and far between. Regulations for nursing home um, is is very hard when it comes to smoking, and so there's a lot of them that stop taking smokers. It is it is hard to deal with and make sure
Yeah.
you're meeting everything, and you're dependent on those smokers, and then you've got to take staff off the floor, so there's a lot to it. So they don't take that at a personal care home. In a nursing home, you're going to have smoke times.
Right.
So they're going to take you out in the morning after breakfast. They're going to take you out after lunch, those kind of things. In a personal care home, you can smoke whenever you want to.
Yeah.
Those kind of things. So you can have your own cigarettes. In a nursing home, you can't. And a lot of that is what drives people to say in a nursing home setting, I want to go to a personal care home, because it's
Yeah.
more freedom. So
Yeah.
as you can see, there's so much out there, and there's just so many differences. And truthfully, every bit of it is on a case by case. Um, and you just have to do your research. You have to talk with the right people. And you just need to be talking with people that are going to help you make the right decision for your loved one, because that's what
Mm.
it's all about. Is it doesn't matter what you think. I said this, I think, on our first podcast together. It's not about you. It's about your loved one, and it's about
Yeah.
what's
Yeah.
best for them. So,
Yeah.
is it skilled nursing and short-term rehab at a nursing home? Are you at a point that you really need to consider nursing home? Um, is it a rehab hospital that will get you up, get you better, get you home quicker? And if you can
Yeah.
do that, that's the way to go. Stay home. Is
Yeah.
it a personal care home? Is that what really, and I will say this about personal care homes, the majority of personal care homes will take Medicaid. So, that becomes part of the conversation too. So,
Yeah. I tell you,
again,
it is such a, this is really just scratching the surface in these,
it is.
even though it's been 30 minutes, it's still about 20 minutes of conversation. That's what, like Ann had said, just reach out, just send an email,
Yeah.
and can't suggest enough to just share all this, because just
Yeah.
the treasure trove of information that came out of your noodle is a lot, and it's very important because there's so many
Yeah.
people that are facing it and will be facing it. Was there anything you want to add real quick before we wrap up here?
No, I don't, I feel like sometimes I'm saying all this and I don't want to confuse anybody. And I think the best thing for you to do is to reach out. Just let us
Yeah.
help. This is
Yeah.
this is not going to cost you anything.
Right.
For you to
Right.
reach out and talk to us and give you information is not going to cost you anything. So
Yep.
we're not saying reach out because we're going to charge you. Just reach out, get the information that you need, and let's do the right thing. I'm like you. Share this, please. Subscribe to the channel so that more and more people see it. And then don't forget who's coming up in August, that we have
Mm.
Teepa Snow coming on board, that we have Second Wind Dreams coming on. Stay tuned for all of that. We just look forward to bringing the information.
Yep. And what will we be doing on episode 3?
We're going to talk home health. We're going to talk about home care, and we're going to talk a little bit more about hospice. I'm not going to deep dive hospice because I've got Scott coming to do that for us, but we are
Yep.
going to talk about what happens with all of those.
Excellent. All
Okay.
right, everybody. Want to thank those that are tuning in, and like Ann had said, share, subscribe, get this
Yeah.
out there. We're doing this to try to help and make a difference. And again, we have so much content coming. I can't really say enough how much stuff is
Right.
coming. And
Right.
so, Ann, great job. Thank you. I wish
Thank you.
everybody a good day. And until the next episode, we will see you later.